Appreciate my colleague. I am in such strong support of your legislation, the No Junk Plans Act, and will speak briefly on it after you've concluded your important remarks. But apropos of what the distinguished senator from South Dakota just said, isn't it correct that, of course, a plan is more affordable if it doesn't cover anything? I'd be interested in my colleague's reaction to that because she's the lead sponsor. I remember being in Wisconsin, seeing the wonderful support that folks there have for my colleague because she's been a leader on these issues. And I'm just curious because certainly my friend from South Dakota is a distinguished member of the Finance Committee, works with Senator Cortez Masto and myself, often works with us on matters, but unless I'm missing something, he said that what he's interested in is care that's more affordable, but it doesn't cover anything. What's my colleague's thought on that?
Well, I would concur and say that the reason they've earned the nickname junk plans is because, frankly, some of them are hardly worth the paper that they're written on. If you think of, first of all, they do not have to comply with some of the very important protections that we included as part of the Affordable Care Act, otherwise known as Obamacare, especially to protect people who had been ill once before or had been injured once before, people who have a pre-existing health condition, maybe a chronic condition that will require medical care throughout their lives. And in the old days, where apparently the Republican senator wants to return, there were all sorts of abuses, I would argue, that insurance companies could employ in order to limit their exposure, if you will. So they had annual limits, they had lifetime limits, they had the capacity to drop somebody from coverage after an illness developed. They had the capacity to say, no, we're not going to offer you insurance. They had certainly the capacity to charge a discriminatory premium based on the pre-existing condition. And that causes great concern. I just saw recently a report about how much typical, I don't want to put it this way, a woman with a breast cancer diagnosis who requires chemotherapy and radiation treatment and medication, how much she would be anticipated to spend out of pocket if she had a junk plan at the time that that diagnosis was made. And it was on average $40,000. $40,000. So we also need to talk about another impact that these junk plans have. And that is that if you think that you have a really good chance of being healthy for the next year, and you decide that, oh, this is a risk that I can take, you are then fundamentally changing the structure of the marketplace for everyone else, because you can anticipate that this is a choice that healthier, maybe younger people will take, and it has a distorting impact on premiums in the marketplace. And in fact, that is why these plans were curtailed under the previous administration. And now this administration is greatly expanding these. They are no longer short-term, they are long-term, and a lot of harm will come. I wanted to just conclude that when we have an administration that first fought legislatively to repeal the Affordable Care Act, that then acted administratively to undermine and sabotage the Affordable Care Act through all sorts of again, administrative executive actions, including defunding the state navigators who help people make wise selections for their insurance, and also limiting the open enrollment period. When we have an administration that has decided to go to court and ask the court to strike down a U.S. law in its entirety, we know that there's sabotage going on. And I think that the choice for the American people couldn't be clearer. We want to make things better. And the administration, enabled by some of my Senate Republican colleagues, are walking down a path that has led to 2 million people losing their health insurance, and others at grave risk of losing it in the future. With that, I yield.
Senator from Oregon.
Before she leaves the floor, I just want to tell my colleague from Wisconsin, I think I can speak for the distinguished senator from Nevada as well, that we're counting on our colleague from Wisconsin to come back to this floor again and again and again to try to pass her bill. And I just want to tell her I will be with her every step of the way, because I think, colleagues, what we're looking at without the distinguished senator from Wisconsin's bill is a new golden age for scam artists peddling insurance that isn't worth much more than the paper it's written on. And I was struck by my friend from Wisconsin mentioning the old days of junk insurance. Well, I was around for those old days. I remember when the health insurance system in this country was basically for the healthy and wealthy. If you were healthy, no sweat, you could get insurance. If you were wealthy, you just went off and paid the bills. But the insurance companies could go out there and clobber people with pre-existing conditions. So that was junk insurance. But I'm even older than that. I remember when I was director of the Oregon Gray Panthers, and I would go to a senior's house, and they would pull out a shoebox full of policies, 10, 15 policies. Distinguished senator from Nevada, who's done so much consumer advocacy for seniors, I'm sure knows about this challenge with seniors. These policies weren't worth the paper they were written on. And they had, because I'm kind of a lawyer in name only, what were called subrogation clauses. So if you had two policies and what they basically covered the same thing, both of them would try to squirm out of covering you. So talk about junk insurance. And finally, I got elected to Congress, like my colleague, activist, and we passed a law that said we're going to get rid of that system, that you could have really only one policy except in unusual situations, and there were strong consumer protections. But if you look at what the Trump golden age of scams is going to bring back, there are going to be lots of people who are going to get clobbered. And as my colleagues know, the people who are really going to get hit by this are, for example, older women who are pre-Medicare, because very often, their late 50s, early 60s, they have a lot of difficulty trying to find jobs that pay good salaries, jobs that have health care coverage. So I am so appreciative of what my colleague is talking about. We're going to hear a lot of buzzwords by opponents of the Baldwin legislation. They're going to talk about how they're offering flexibility and they're offering patient, centered care. But that's just a bunch of eyewash, because what they really do, as you touched on, is fail to give patients care when they most need care. So today, Americans ought to be protected from these worthless, predatory scams. And one of the things that I was proudest of, really before my colleagues came here, is I wrote a piece of legislation, the Healthy Americans Act. A number of Republican senators, by the way, were co-sponsors of this bill, and it had airtight, loophole-free protection to ensure that people with pre-existing conditions didn't face discrimination. And we, by and large, got that provision into the Affordable Care Act. And it meant, as John McCain knew, we often talked about it, that health care would no longer be there just for the healthy and the wealthy. There'd be real protections for those with pre-existing conditions. And that was, for all practical purposes, really one of the 2 or 3 centerpieces of the Affordable Care Act. Because talk about a new age in insurance, that was it. Health care insurance would no longer be there for the healthy and wealthy only. So, Senator Baldwin is here, and what she's trying to do, I'm looking at that clock, she's trying to keep the Trump people from turning it back. That's what they want to do when Senator Baldwin talks about the old days, a forced march back to the days when the insurance companies could really, in many instances, just beat the stuffing out of vulnerable people. So I want to thank my colleague for what she's doing. I heard just a little bit before I came over about it, and so I basically said, let's hold off on things for a couple hours so I can go out there and stand with Senator Baldwin and her allies. And to me, what's important is that you've been here today, and it's going to be even more important that you come back again and again and again so that that clock continues to move forward in terms of American health care and not go backward. I thank my colleague, and we're really delighted to have Senator Cortez Masto on the Senate Finance Committee, where she's been doing a lot of good work in health care and for consumers and seniors, and I look forward to her remarks and working with both of my colleagues.